I think only Paul briefly touched on, but I'd like to hear your perspectives about, which is what then lies behind the problem with healthcare inflation? Because we can tweak the healthcare insurance, co-payment, premium, government spending as much as we want. But if we do not control healthcare inflation, then the cost of healthcare will potentially spiral out of control. And just by way of illustration, I think Paul will know this quite well as well. One of the major universities here recently had its healthcare plan changed precisely because of healthcare inflation. And this is a particular problem because if a university, if you think about it, that has lots of healthy people, young healthy people, can't afford to pay the insurance, then the weight on other corporations may be much heavier.
Let's go.
Yeah, there are many drivers of healthcare inflation. When it comes to the university and its change of healthcare providers, I'll take this offline and talk to you about it in detail. I have my own theories. One of the main drivers of healthcare inflation is unbridled use of non-evidence-based medicine. And what this means is that, in a completely free market system, see, a mainstream media publication, for example, can sell advertising space every one particular day in a week to commercial medical providers who may not necessarily be dealing with medical needs, but they're trying to tell you how to look better, how to look younger, all this kind of thing. And I think you know what I'm talking about. See, all of that has to be paid for by somebody. So if that is going to be paid for by the patient, you see, I'm not being too obscure. What I'm trying to say is that when you release the floodgates to a commercially available medicine, when we try and move towards the US-style medicine, where you have you can advertise on television, you can advertise in the newspapers, you can advertise everywhere, and then you end up with a system which tends to be very market-driven, very consumer-driven, and healthcare becomes an industry rather than trying to deal with the needs of people who get sick, people who want to function normally, people who want their children to be healthy, they want their parents to be healthy, they want to be productive members of society. So that's one of the big drivers is the commercial aspects and the commercialization of medicine. The second driver that the SDP plan specifically addresses has been labeled as rationing. But what it is that the SDP plan proposes that they will only fund treatments which have solid evidence behind them. And in the UK, they have a body called NICE, which is the National Institute for Clinical Excellence, which actually will review the scientific data and will see whether a treatment actually is going to benefit you. And it's not because a drug company says that it's going to benefit you, or somebody has got some fancy new piece of equipment, or they hire a MediaCorp TV star to advertise for the process, but it's actually because it works. And that's what patients want. They want a treatment that works. See, they want somebody to cut through all the advertising. They want them to tell you, does it work or does it not work? And there is evidence that NICE has reduced healthcare inflation in the UK and in Europe, where there are similar state-funded bodies to try and examine the evidence. There has been a slowing of healthcare inflation despite the aging populations in many of those settings.
Okay, thank you. Anybody else?
I think it's definitely a concern, healthcare inflation. And I agree with what Paul said about the supply side, where for the high end, there's a lot of unnecessary interventions that are being pushed by providers, by doctors. But I'm actually more concerned about the healthcare inflation on the lower end. That means in the public hospitals, the inflation that affects the ordinary Singaporean. I'm less concerned about the healthcare inflation that affects the patients that go to Mount E, or the Indonesian patients who come from overseas and seek treatment over here. And one of the things that I think is one of the reasons why we're not being able to contain the inflation as well as we could, and which I touched on in my speech as well, is a lack of integration between primary, secondary, tertiary, and long-term healthcare providers. Because primary healthcare refers to GPs, the polyclinics. Tertiary would be your major acute hospitals. Now, if a lower income patient is not able to afford the cost of primary healthcare, he'll just avoid treatment. He just won't go to the doctor. So his condition gets worse, and then Suddenly he gets a heart attack or he gets a stroke, he collapses, and then you have to send an ambulance and you have to send him to hospital, go into the emergency room. That is a big cost on both the system and it's a big cost on the patient as well. So if we can better integrate primary healthcare such that primary healthcare with tertiary healthcare such that people get the treatment that they need at the right time at the right place, then there will be less of a pressure to reduce the inflation. There's less of a concern that people will not be able to afford it because they will get the treatment when they need it. And there are other areas of reducing costs, things like I talked about the National Electronic Health Record System. This is supposed to be a major system which integrates all your health records together such that you can go to different hospitals and they all have the same records in front of them. Now this can reduce costs because the doctor is able to access your records, he's able to make a proper diagnosis without and there's less chance of errors. Errors also cause burden on the patients. So if we can roll that out properly, that could actually help to reduce the cost for the system and help to reduce the cost for the individual. Unfortunately, that has not been rolled out as much as it should be. There are only about 50 GPs that are using that system right now, compared to over 2,000 GPs that are operating in Singapore.
Thank you.
Gojin, may I just add something?
Oh, yes.
Yeah. One aspect or perspective of the healthcare inflation is that we have the most profitable national health insurance scheme in the world. For years, your MediShield, you track the premium versus the claims, not even counting the interest on the excess payments. We have the most profitable national health insurance scheme in the world. So this is what I call us the monkey see, monkey do system. If the government is making money on your national healthcare, what do you expect all the other healthcare players to do? Don't make money? And this contributes to healthcare inflation.